Hello everyone, welcome back to FNP University, your premier resource for practice-changing knowledge. Back with another video to help you navigate the complex world of healthcare. Today, we're diving deep into a topic that's crucial for all of us as nurse practitioners, the art and science of prescribing antibiotics. If you find this video helpful, don't forget to like, share, and subscribe, as this helps us grow to better serve you all. Let's get started. Antibiotics are a powerful tool in our medical arsenal, but they must be used responsibly. Misuse can lead to antibiotic resistance, a serious global health concern in which many factors play a role in this crisis. So, how do we prescribe antibiotics effectively and responsibly? First, it's important to determine whether an antibiotic is necessary. Not all infections are bacterial, as we know as clinicians. But here is a gentle reminder that a large majority of illnesses are viral, and antibiotics won't help. For example, the common cold and flu are caused by viruses, not bacteria. Always consider the patient's symptoms, history, and if possible, lab results before deciding to prescribe an antibiotic. This includes a culture of the site or the areas of concern. Second, choose the right antibiotic. Different antibiotics work against different types of bacteria based on how they work on the cell, what kinds of bacteria they cover, and what body systems they work best on. Broad-spectrum antibiotics affect a wide range of bacteria, while narrow-spectrum antibiotics are effective against specific types. Whenever possible, choose a narrow-spectrum antibiotic to minimize disruption to the patient's normal flora and reduce the risk of resistance. For example, if you're treating a patient with a simple urinary tract infection, a narrow-spectrum antibiotic like nitrofurantoin may be a good choice. You can also consider Bactrim, but this is falling out of favor due to resistance and concerns for sulfa allergies. But if the patient has a more complicated infection, or if the causative bacteria isn't known, you might need to start with a broad-spectrum antibiotic like ciprofloxacin. Notice how we did not say levofloxacin, as this is a respiratory quinolone and should not be used in this case. Always consider the drug penetrance as well as the ability to concentrate in the organ we are treating. For example, nitrofurantoin has great MRSA coverage, but we would not use for skin MRSA infection due to primarily concentrating in the bladder. Third, prescribe the correct dosage and duration. Overprescribing can contribute to antibiotic resistance, while underprescribing may not effectively treat the infection. Always follow the latest guidelines and adjust based on the patient's age, weight, kidney function, and the severity of the infection. Lastly, educate your patients, which will go a long way, but will take more time on your part as the clinician. Also ensure you are taking their medical history into consideration, as conditions like diabetes will change the agent of choice. Also ensure they are not immunosuppressed or on biologics or other agents that suppress the immune system like tacromylus. Make sure they understand the importance of taking the full course of antibiotics, even if they feel better. Skipping doses or stopping early can lead to antibiotic resistance. I'd love to hear your experiences with prescribing antibiotics. What challenges have you faced? How do you decide which antibiotic to prescribe? Share your stories and strategies in the comments below. Prescribing antibiotics is a big responsibility, but by staying informed and following best practices, we can ensure we're using these powerful tools effectively and responsibly. Remember, the goal is always the health and well-being of our patients. That's all for today's video. If you found this information helpful, please give this video a thumbs up and share it with your colleagues. Don't forget to subscribe to FNP University for more in-depth discussions like this one. As always, be well and stay healthy.